Welcome to this explainer. In so many parts of the world, distance isn't just a travel hurdle, it's actually a deadly disease. Today we're going to completely unpack the RuralPulse project plan. We're looking at how some incredibly smart, structured solutions are stepping up to bridge a massive healthcare gap in literally some of the most isolated places on Earth. We're going to explore how they are turning raw data into the ultimate digital infrastructure, delivering top-notch care to places where paved roads just simply do not exist.
So let's just put ourselves in that situation for a second. Imagine you live in a remote, completely isolated mountain village. You wake up and you just know something is incredibly wrong. You're sick, maybe you're in severe pain, but there's no urgent care clinic down the street. You can't just hop in a car. In fact, studies actually show that in these rural areas, just a few extra miles of travel can drastically increase mortality rates from medical emergencies. So it really begs the question, when there are no roads and zero local clinics, how do you actually treat patients who are miles and miles away?
Well, that physical distance, it's not just some minor inconvenience, it is a literal geographical wall. We are talking about insanely rugged terrain, totally unpredictable weather, and practically zero physical infrastructure. All of this creates a really dangerous disconnect from the modern healthcare system. Think about it. When a patient is entirely geographically isolated, the sheer amount of time it takes just to seek out help can allow a minor, easily treatable symptom to just completely spiral into a full-blown crisis.
Now, the traditional answer to a problem like this is usually, okay, let's just build a hospital, right? But the RuralPulse solution takes a completely different, totally fascinating approach. Instead of bringing the patient to the clinic, it brings the clinic directly into the palm of the patient's hand. This is RuralPulse. It's a multilingual voice and text triage interface that runs right on a standard smartphone, entirely inside a rural home. Without taking a single step outside their front door, a patient living in total isolation suddenly has this direct, incredibly reliable lifeline. They can just speak or type in their native language, sitting right there in their own living room.
And here is where the real magic happens. It's all thanks to the system's preparation agent. Think about how we actually talk when we're sick. We don't use medical jargon. A patient might colloquially say something like, my belly has been acting angry since Tuesday. And hey, that's a highly descriptive, very human way to explain pain, but it is definitely not medical terminology. So this preparation agent acts as this vital translation bridge. It instantly takes that messy, spoken human experience and translates it into structured, doctor-ready data. The exact kind of organized charts you'd expect to see on a sleek medical dashboard. It's not just translating the language, it is literally translating context right into clinical science.
Because of that translation, we get this incredibly rapid, structured workflow. It's basically a three-step process. Step 1, the patient simply uses the smartphone interface in their village. Step 2, that preparation agent does all the heavy lifting behind the scenes, translating those everyday colloquial symptoms. And then step 3, instantly, a doctor miles and miles away receives a perfectly organized diagnostic dashboard. Just like that, the massive physical distance of the mountain, along with the linguistic distance of colloquial speech, are completely wiped out before a single direct word is ever even exchanged between the two of them.
At the end of the day, what we're looking at is a completely friction-free clinical workflow. By the time the doctor and the patient actually connect for a consultation, all those initial administrative hurdles, all those translation barriers, they've already been cleared. The doctor isn't wasting precious time trying to decipher what an angry belly means. Instead, they're reviewing a precise chart indicating specific gastrointestinal distress timelines. We've taken a totally isolated patient and given them a seamless modern clinic experience where the interaction is completely optimized and focused purely on care, treatment, and connection.
So I'll leave you with this to think about. If a well-designed smartphone interface, when paired with a smart translation agent, can literally bypass the massive geographic isolation of a remote mountain village, what else is possible? Seriously, what other cultural, financial, or educational barriers in global health can we translate away next using these exact same mechanisms? The RuralPulse project plan really proves that sometimes the most insurmountable physical obstacles can be conquered with structured, accessible data. Thanks so much for joining this explainer, and keep questioning the structures around you.